So just going on to people who have inherited the hemoglobin S from both parents. Now that's called sickle cell anemia, or hemoglobin SS. And they get a lot of problems because of this sickling or changing of the red blood cell. When it blocks up the tiny blood vessels, it's like blocking up the sink. You just don't get things going through. So all the cells that are on the other side of the blockage, they're at risk of dying or being damaged. But also, the blockage causes lots and lots of sort of inflammation as well. So what we find is that people have a lot of pain. And it's very hard to describe to doctors, nurses who aren't used to looking after people with sickle cell anemia, what that's like for the patients. The pain is very severe, but because you're looking at someone and it's like an invisible pain to everybody else, I don't think it's always taken as seriously. Whereas people who go into hospital, they need things like morphine and very strong painkillers and need special care. So again, one of the things that we're trying to promote through coming to do talks like this and at the hospital is to encourage that people with sickle cell anemia need special care, either if they're coming to A&E or on the wards. So again, for children who are affected, we try and do lots of talks in schools because it's important for the teachers to know how to look after these children. Again, very busy slides, but all I want to demonstrate is what people with hemoglobin S or sickle cell anemia, sort of problems that they go through. They can have problems with their lungs, acute pain, problems with their spleens. Children particularly are at a higher risk of getting strokes, and so it would be very important to know if your child's got sickle cell anemia so that they can have scans of their heads sort of every year. And what we encourage is for children to attend their hospital appointments even when they're well. Because sometimes when you're well you think, okay, can't be bothered going for an appointment, I've got to take a day off work, I've got to take time off school. But it's the times that you're well that we check that everything's okay. And for people who have sickle cell anemia, the signs and symptoms can vary. So we could probably have two brothers in the same family who have sickle cell anemia, one who can be quite poorly and is in and out of hospital quite a lot, and then the other one who goes to school, not many problems, just attends all the normal sort of outpatient appointments and investigations. It's important to know that there is a genetic condition. It's not something that's contagious. It's just the same as all the instructions you get from your mum and dad about the colour of your eyes, your hair, how tall you're going to be, etc., the shape of your nose. It's a genetic condition, it's not contagious. It is present from birth, but usually we don't notice the signs and symptoms until the child is about 4 to 6 months of age. And the most common sort of signs and symptoms are the anemia, because the red blood cells are dying so quickly, and the pain because of all the blockage of the blood vessels that can happen. What we also know is that there are certain things that can set off what we call the sickle cell crisis or the painful crisis. So that's when you've got the sickle shape, red blood cells blocking up the blood vessels. Very hot and very cold temperatures can set off a sickling crisis. Being dehydrated can set off a sickle cell crisis, and also very low oxygen levels. Infections can make the crisis worse, and emotional stress and strenuous exercise. So it's important for people who have the condition to know this, but also for other people who are involved in their lives, like the teachers, the nurses. If you have a child at school, we like to go and do a visit in the school so that we can assess the school environment. So we can see if the classroom is warm or warm enough, and the children need to be able to drink water all the time so that they don't get dehydrated. So we encourage the children to carry a bottle of water or juice around with them all the time. Hypoxia, that's just very low oxygen levels. Can happen if you're exercising quite a lot and you're becoming breathless. Emotional stress, so a lot of the children, once it comes up to sort of exam times, find that they sometimes get a lot more sickle cell crisis. And so we try and work with the teachers on giving them extra time to do their examinations, just so they're not rushed, encourage them to drink water while they're doing the exam. One of the organs that gets damaged quite quickly is the kidneys, and what we find is that because people with sickle cell anemia can't concentrate their urine very well, they go into the toilet quite a lot. So especially for young children, we're encouraging all the teachers to give them bathroom passes so that they can go to the bathroom without having to kind of put their hand up in class and feel different from their peers. Does anyone have any questions so far about what I've said about being a carrier or having the major sort of condition, the sickle cell anemia? No.
Yes. Well, I have a niece, sickle cell anemia. I really don't know what it is, but I think it's SS. Because we didn't know, back in Africa, because my mama and dad, we don't know who had it. We just noticed from the children of their children. Now, I think my sister was AS, and his husband as well. That's why they had, because they have five. One has died, one boy, and the girl is the three are fine. They are A, but the girl was SS, and the girl is SS, and the boy as well. He was. Now the girl, the problem is with the girl. Because she's not here, I just wanted to know more how I can help. Because the girl in 2000, before I come here, I did adopt the girl. She was adopted by my, but I didn't receive the judgment. I didn't receive the legal document to have her. Right. So she stayed behind. But the trouble is, she's going through a lot of problems. Recently, she was raped, and she went through.
Oh, Jesus!
I want some advice.
Okay. What sort of particular advice? Is it about help to get her to the UK? Or?
Yeah, we did an application because they gave us the legal document to have her. We did an application in the home office there back home, and they haven't answered yet. But I want to know more. Maybe they will refuse, because they might refuse as well. But the help I want for her health, which I can do, because I can go there, and I can maybe bring some medication, something. But at least if she's safe or healthy, all good.
Sure. We're based at the Merlin Vaz Health Centre. I'm not sure if you know where that is.
I know.
Yeah? So in the room behind you in the kitchen, I've left some little business cards with our contact details on there. I think if you contact us, and then we could spend a lot more time sort of talking about how we can help you and what information we can provide. Would that be okay? Yeah. What was I going to say about carriers? I've told you that you need to know. Lost my train of thought now. Any other questions?
If somebody is a carrier, how long can you stay in a plane and travel?
If you're a carrier, okay. If you're a carrier and you go on one of these big planes, there shouldn't be any problems because they're all pressurised. So it's just to make sure that you do the same as all the other passengers on the plane. You're drinking lots of water, staying hydrated, walking around, exercising your legs. They're all things that people do to help prevent getting clots in their legs. But it's the same sort of principle, so it's just preventing problems. But this shouldn't cause any problems while you're in the plane at all.
You know how you say that